on strengthening their knowledge and helping them further for clinical practice. We have with us Dr. Dinesh Chauhan, sir, who will be taking 2 sessions on gentian nail, and the registrations are already open. The early bird will be ending soon, so do register if you're interested. He will be covering gentian nails through APG4 classification. We have Dr. Mayuresh Mahajan, sir, 1 session with him on pathological cases and how to treat pathological cases using homeopathy and using specifically HSF mind method. We have Dr. Aradhana Chitra ma'am, who will be taking anxiety and panic a 360-degree view, and total 4 sessions are there. The registrations are open. You all can register for the same as well. Another interesting course on lanthanide by Dr. Jonathan Hardy will be starting soon, and we have 4 sessions for the same. Another course on nutrition with Dr. Nandita Shah ma'am is something I look forward to personally, and you can register for the same as well. We have Dr. Prajakta Vaidya and Dr. Preeti Shah, who will be taking practical application of homeopathy in psychotic disorder. Another interesting and a very valued membership program that we have on our website. You all can take the access, and there are a lot of perks. So I highly recommend you to go on our website. I will share the link to everything on the chat box. Before we move on, I please request you, whoever is scribbling, stop scribbling on the screen. It's very distracting. Please mute yourself while the speaker is speaking. If you can keep your videos on for a better interaction, that will be great. Make your notes, share your experiences. In case you have any questions, queries, difficulty, write it in the chat box and we'll definitely address it at the end. Without wasting any more time, I will stop sharing. I will invite Dr. Prajakta ma'am for continuing the session further.
All right, thank you, Taskeen. And good evening, everyone. It's nice to see all of you here. And the idea with ABC of remedies is to learn the remedies from all the aspects, the holistic aspect, to know our remedies. Okay, so how we are able to match the holistic aspect of the patient, where we take a detailed case taking. If we understand our remedies from all these perspectives, knowing the classically what the authors have said about it, what is the contemporary evolution in the remedies, then we are able to match that with our patients. Okay, and we have been doing, as Dr. Taskeen mentioned, today is the another remedy that we are going to cover is the carcinosin. Okay, is my screen visible, Taskeen?
Yes, ma'am.
Oh, yes. So let's go ahead. Okay, so the carcinosin as a remedy, okay, it was proved by W.L. Templeton, and we are very thankful for the proving, but there is a lot of work that has been done by D.M. Forbister to give the clinical application of this remedy. Okay, so carcinosin as a remedy, it is from the nosode group. Okay, and it is prepared from the cancerous breast tissue. Okay, so the nosodes are the remedies which are prepared from the disease part of the disease part. Okay, so and it is in carcinosin, it is basically from the cancerous breast tissue. And what the Forbister has observed that this remedy is very well indicated when there is a strong family history of cancer. So in any form of cancer, but mainly the breast cancer. That is what Forbister has mentioned. Then, if you see from the all holistic aspect, what Forbister has mentioned is a very very important indication. Okay, so in the physical appearance, you see the cafe-olite spots that we see. Then pale complexion with numerous moles, blue sclerotic. Okay, these are the some of the indication where the complexion and the physical part of the carcinosin patient would be seen. At the mental aspect, if you see, he mentioned that there is fundamentally what is there is the main feeling of this prolonged fear and prolonged unhappiness that he has observed. Then there is lot of anticipation that we see. There is lot of these anticipation. It takes the form of worry. Sometimes it is amounting to anguish. So the things like, late arrival of the child, husband or wife, there will be a lot of anticipation that you will be able to see in this remedy. Plus, in the young children, you will see the lot of anticipation about the failure in the examination. So, fear, worry, and lot of anticipatory anxiety we see here. He's given it lot with a lot of comparison. So when you say anticipation and the anxiety, what are the remedies that come to our mind? Like argentum nitricum, arsenic, carboveg, gelsemium, lycopodium, medorinum, phosphorus, silica, thuja. But all these remedies will have their own different reason for the anticipation. Okay, so if you see in the argentum nitricum, the anxiety is about how to about the performance, right? If I don't perform well, then I will be there will be a lot of this anxiety and fear will be there. If you see gelsemium, there is lot of these anxiety or anticipation when they hear a bad news or they feel that something is going to happen, which is also connected with lot of this feeling of shock because it is the remedy from the plant kingdom. Okay, if you see meadorhinum as a remedy, it is also one of the nosode, right? So in the meadorhinum, the anxiety is basically they feel that there is some inner weakness within them and that can get exposed, that can get be seen by others, right? And that they try to cover. So there is a lot of anticipation, anxiety, and they also want to have this weakness to be covered. So a lot of hiding is there. And that anxiety in the meadorhinum will be seen at a various levels. They become very conscientious, they become very hasty. A lot of this anxiety will be seen. In silica, if you see, the anxiety will be more of performance. But how it is different from argentum nitricum? Because silica has so much of expectations from the others. They give lot of importance. They want to be, good in front of the other. Their image is more important. So they feel that if I don't perform well, my image in the society or image in front of my people will be gone. They will laugh at me. And that anxiety get expressed in form of performance anxiety. Like that, we have to differentiate from the remedies with these anxieties. But in carcinosin, how it emerges, we will see it again. In carcinosin, what happens? The anxiety is that he feels that everything which is happening is very chaotic around him. Okay, because it belongs to the cancer miasm, right? So this cancer, what is cancer? It is the chaotic multiplication in the body, right, of the cells. So the same feeling get expressed. There's a lot of chaos. There's lose of feeling of this losing control, and then they want to control it. They want to have everything in the balance, in the in their own control. And then there is this lot of anxiety starts coming. So they give a lot of attention to the detail. They want to be very perfect. And they look like very fastidious, like arsenic, Naxomica, and anacardium and graphitis also. Hmm? They will till the point that they can become very obstinate and very neurotic about certain things, that they want things to be in this place, they want this kind of a cleanliness. And you can see that some correlation with the tuberculinum as a remedy. Then they have this long, strong sense of rhythm. They love dancing. And this is the very confirmatory symptom for carcinosin. This is also seen in sepia. We know, right? Dancing ameliorate. If you see in the repertory, dancing ameliorate, dance required, sepia, carcinosin is the one of the very important remedy in there. So the carcinosin, as an individual, they are very artistic. They have this artistic aptitude for dancing, singing, drawing. They are very sensitive for music. So they can become very sensitive and can also weep. Okay, along with Naxomica, Thuja, but all will have difference in the sensitivity, right? But in the materia medica, if you see, Naxomica and Carcinosin are the only two remedies where there is fastidiousness and sensitivity to music will be there. So it is very important to, in form of confirmation, if we see this fastidiousness and sensitivity to music around. They also like carcinosin people, they love or they are actually better during thunderstorm, like sepia again. So they come very close to sepia as a remedy, and tuberculinum as a remedy, as a Naxomica as a remedy. It is an, if you see as a person or a constitution of carcinosis, is mix of lot of remedies when we see. Okay, so they will look like sepia also. They will also look like Naxomica. They will, with the fastidiousness, they will also look like arsenic because, too much of anxiety and anticipation. But at the same time, they have the plant-like sensitivity also. So like phosphorus, they will be very sympathetic to others. Plant like ignatia, they have a tendency to kind of suppress a lot of things in their mind. They are also very sensitive to reprimands like Staphysagria and ignatia as a plant remedies. Then in like Medorinum also, they are very sensitive for the reprimand. Okay, so it is very important to see all these aspects, but how we can differentiate the carcinosin as a remedy. Okay, then we see a lot of modalities. What are the modalities? Heat or cold. They are both sensitive to heat and cold both. Okay, so they can get aggravated by too much of heat or too much of cold. Like that would be the specific modality for them. Then the influence of the sea air is too much is seen in carcinosin. So either they are aggravated or they feel better on this seashore. So it's one of the confirmatory symptom for carcinosin. Medorinum will also have, but medorinum has more of aggravation at the seashore. Then they have worse modality of worse on undressing. Okay, so cough or the skin symptoms get aggravated on undressing, as we see in rheumatics as a remedy. Their cough is aggravated on talking and laughing, like phosphorus. And they are better after short sleep or cat naps. What do we call, right? So they feel better with it. So if you see carcinosin, according to the Forbister, they have the sensation like throbbing, beating kind of a sensation. Their discharges are very acrid and thick. They have various cravings and aversions. And those cravings can become aversions later. So salts, eggs, milk, fat, fruits, they will have craving or can be aversion or vice versa. And causalities is very important. With the family history of cancer, or any chronic complaints like tuberculosis, syphilis. Most of the time it is seen, right? Then the clinical tips, there would be alteration of symptoms like Laccan and CPM, because Laccan is one of the very important remedy for altering the symptoms. Symptoms go from right to left, and but in Laccan, the symptoms again come back to the original side of the complaints. That way we can differentiate Laccan also. Then periodicity, if you see in carcinosin, aggravation from 1 to 6 p.m. They have a lot of these mole, cafe au lait, complexion, we just saw in the beginning. If you see sleep, it's one of the very important remedy. If there are disturbances of sleep, insomnia, restless sleep, children who are difficult to fall in sleep, or they are awakened by shudders, or sometimes, by a lot of activation of their mind, like coffee. So they can lie in the bed entire night without sleeping. Hmm? And the position, if you say, this is also one of the very important and confirmatory for carcinosis, is genubectoral position. It is also seen in meadow, sepia, tuberculum, lycopodium, phosphorus, and calcarea, but other things will differentiate carcinosin from the remedies. So he says that if you have a child, okay, who is very, very obstinate, he has love for traveling, is also one of the part of carcinosin, like tuberculin. Then if you add the amelioration by the sea, okay, which is like a medorrhinum, aggravation or amelioration, then we can think of carcinosin as a remedy. Okay. Or he also mentioned that if there is any, case with the cancer case, or anywhere where there is a complete and strong history of carcinosin, then you can begin the case with the carcinosin as a remedy. Okay, this was all about Forbister, what he said. Now, if we have to see a child carcinosin, if you have to prescribe, what do we see in the children? Generally, we know the carcinosin are very, very sensitive. So they weeps from reprimand. Okay. Then they are very sympathetic, compassionate children. But other side, they can be also very angry, shrieking. They can have nightmares. Somnambulism is also seen in carcinosin. Very inquisitive. They are precautious like an adult. So in precocity, you see carcinosin as one of the very important remedy. This is for the normal or the high active mental state of the child. But you can also prescribe that in backward child, like, people, the children who are dull, where thinking is difficult, or they are aversion to conversation. Those children in the mental pathologies also we can see, consider carcinosin as a remedy. Biting nails, passion to read, and very playful children, then we can consider the carcinosin as a remedy. Now, when we look at the contemporary side of the remedy, we see that there has been a lot of work that has been done in terms of the remedy, okay, as a carcinosin. So Dr. Shankar sir described this remedy as the center of cancer miasm. Okay, so it is between the psychosis and syphilis. The cancer miasm lies. Okay. So what is psychosis and what is syphilis? And then what is the indication of the nozo? When we can prescribe this remedy? Okay. So when you understand the nosode, okay, so nosodes are prepared from the disease products, okay, and they are made from that tissue which is the under the influence of that particular infection, okay. Now, when you see in the patient, they are just talking about this process of infection, right? Like in Sorinum, there will be more of what is Sora is for struggle, right? So when we see in Sorinum, there is a lot of struggle. In psychotic remedies like Medorinum thuja, there is a lot of process of this covering and fixity and covering up the weakness. In syphilis, we see a lot of despair and distress. Okay. when we see this kind of a only expression in the case taking, that time there is an indication of the no zone that comes around. So there are no specific human core issues. So if you take a case and if you see there are no signs, or there are no themes of any structure that is affected, there is no issue of sensitivity or reactivity, there are no animal kingdom issue that you see in me versus you, and there is only the expression of the miasm without any specific sensation, then we can consider nosode as a prescription for that remedy. We'll see that in the cases. So in Soul of Shankar, Dr. Shankaran sir writes that the carcinosin, the main feeling of them, of the patient, is that their survival depends upon performing a task which is very, very difficult, which he is incapable of performing. And they want to do that, they have to do that, and they kind of try doing it beyond their own capacity. So what happened? The patient, they stretch themselves a lot, up to the level of a lot of destruction. Okay, because they want to do it. They have this hope of success, but because if they fail, it can become like the feeling is of death and the destruction. So what happens is that they put their tremendous effort, superhuman effort, to fulfill that task, to fulfill that kind of a responsibility that they have taken up. Okay, so the cancer miasm, it lies between psychosis and syphilis. So you will see the trends of psychosis also, fixity also you will see, plus also you will see the destruction element of the syphilis in carcinosin as a remedy. So you see there is lot of history of taking too much at young age. So people who are had abused in the childhood, or had very strict parents, or very dominating kind of a childhood, and then there has a lot of these expectations which are placed on them, and there is too much at a young age that they take up, and too strict parental control. So they whole kind of modify their life to fulfill this kind of expectations, or fulfill this responsibility, or this kind of a pressure that they take. And how they cope up with it, they do this lot of superhuman effort. So they try to live up to these expectations and make tremendous effort to perform exceedingly well. So what do? They set themselves a very high standards of expectations or a goals from themselves. Sometimes it is given or driven by the parents, or who are strict, or sometimes they themselves do it, right? And then they drive themselves to accomplish that. Try their lot of efforts to accomplish that. And in that process, when they want to kind of reach to that level, they become very, very perfectionist. Because they want to do it very perfectly. And their whole focus goes on performing that task perfectly. Okay, so in order to survive in that situation, okay, so imagine a child who somebody is, the parents are very, very strict, parents are very, very dominating. They have some high standard of expectation from them, from the child. And imagine the situation of the child. What he experiences, he perceives that, yes, this is something that they want me to do, and I take up that. I put my lot of effort, I put my superhuman effort to it. I have to do it kind of very perfectly, otherwise they will kind of reprimand me, and carcinosin is very sensitive for reprimands, and they kind of keep doing it, because if they fail, it can become, for them, their perception is that it is death or destruction. They feel that everything in that whole situation, they feel that there is a breakdown of this control mechanism. Okay, and like a cancer, right? What in cancer also it happens, right? That in the cells of the body. They behave like that it is like, chaotic. There is no control. Everything and everything is just growing, right? It's the same feeling that carcinosin will have, that they have want to have that control. Okay, because they feel outside is very chaotic. It is going out of my control. I need to control this situation. I need to have the order in all of these chaos. And imagine the situation, how they will do it. They do it with a lot of effort when there is a situation of hope of success, but there is lot of effort that is being put. They feel that nothing can be changed. I just want to control everything. Otherwise, everything will be destroyed. I have to do my best, so that I can keep controlling this situation. And then ultimately the stage can come when they are unable to do it, which leads to despair, or this continuous prolonged struggles which have no end. They can bring this despair or suicidal thoughts. So it is one of the very important remedy where suicidal tendencies are common. Mhm. So they need the perfection. So everything, perfection is a very important theme of carcinosin. Lot of tremendous effort. They become very fastidious, and their whole effort is to become faultless. And because of that, this lot of anxiety start, coming in, and they become too much neurotic about it, about to performing that task or to do that task very well, which can lead to suicidal affection. This anxiety is a lot for the health, for diseases like cancer. It can be for examination, it can be for failure, right? And their fastidiousness or their anxiety is like, if there is a party at the house, it's not that anxiety that, a common thing is like, you're worried how things will go. But carcinosis people, they will start anticipating it a lot from very, a lot time before the party. And it is not for them important that the party should go well. But the minutest detail about them, they should look nice, they should dress up well, they should be doing and behaving this way, the house should be like this, the things will should be in the order. Then they set themselves some kind of a standard, and they want to kind of work on it. That kind of anxiety we see in carcinosin. So you see lot of importance of anxiety and anticipation in carcinosin. In the rubrics also you can see if there is an engagement, or stage fright is also there, for examination there, about relatives. If you see anticipation about relative, carcinosin is only one remedy. Then anxiety aggravates a lot of mental and emotional consequences. Then anxiety with lot of conscience, anxiety in the stomach about family, future, health, right? With hurry, with nausea, with cramps. We see a lot in carcinosin. Hmm? Then we see plant-like sensitivity. So they're sensitive to reprimands. They also have these artistic aptitude. So they are very sensitive to music. They love dancing. They draw well. They have the desire to paint, sketch, right? Then they look like lot of time like Ignatia. So Ignatia, the other Ignatia is a remedy from Loganacea family, the main sensation of being shocked. And what is Ignatia's main perception is that in this kind of a situation, I have to kind of, be very strong, independent, take the charge, take the responsibility of everything what is happening around me, and suppress. It's similar like that, which is seen in carcinosin. So they suppress a lot of their anger, their emotion, right? And sometimes, most of the time, they don't like domination, but they just take it without any kind of retaliation till the time there is no other side of it. There is no expression of it, right? So there is a lot of this acute grief which kind of accumulate within. But they don't express much till the time they are able to hold it. So if you see a situational materia medica which Dr. Shankaran has given for carcinosin is a child, you can think of this remedy where the child who had strict upbringing, okay, so the parents think or insist that child should be perfect, okay, so it kind of lead to this carcinosin situation. So they become fastidious and suppression of their desires. Then dancing, what happens, which is this kind of a domination, this kind of lot of suppression, they express themselves in form of a dance, okay, and it becomes like a their survival mechanism. So they love dancing, they love movement, love going out, love having motion, that is their survival mechanism. And then this, out of all this situation, the perfection of them of performing these tasks develops, and that creates a lot of anticipatory anxiety. So what we know about carcinosin, they're very well mannered, good mannered. They behave very nicely, very controlled. They are not mischievous. So the mothers can come and tell you that my child is very very calm, quiet. He's very mature to his age. He's very well behaved, well mannered. He will not do any mischief or any kind of naughtiness. They're very well dressed, talk very nicely, and but their way of dressing is like a refined way. They have the grace in their presentation. They have a specific taste for the clothing that they want to wear. Not like Laxers, because they also want to have a lot of good clothes, good presentation, vivacious, very extroverted. But in Laxers, if you see, there is a lot of gaudiness, a lot of show is involved. But if in Carcinosin, you will see it's more of a taste, that refinement that they need. Okay. Then, as per Dr. Shankaran's sir's superclass concept, it belongs to superclass 5. Okay. So, what is superclass 5? The superclasses basically are the dynamic action or reaction or a response of an individual during the challenging situation or a difficult situation. It also identified with their basic nature, right? So if you see carcinosin, it belongs to superclass 5. What does superclass 5 mean? That the dynamic response of superclass 5 is to go out, okay, coming out. So they are very, very restless inside and they want to get out. There is a lot of desire for movement, okay, and persistent desire to get away from those situations where they are feeling stuck. Okay, so they can be more explorer. They cannot stay inside for long. They cannot be in that domination for long time. They have to break free. Lot of achievers, performers come in this part of superclass 5. Okay, they requires this change constantly. They wants to switch from one side to another. They want to, they are the explorers. They are not like a routinist like row 4, where they want to do the entire, the common routine kind of a work in like row 4. In this, there is more issues of row 5, where there is a lot of thing to explore, go out, doing something new, refine yourself, refine your skills. That is their kind of uh, focus is there. And they have this lot of feeling of being trapped or confined, and they want to come out of it. Okay. So adventurer, explorer, very brave, extroverted individual, less dependent, more assertive. They can be rebellious. Okay. They enjoy their own company, their own accomplishments. They want to perform, very ambitious people. Courageous, push themselves a lot. Okay. And they want to kind of confront their fears. So you can think about the artists, performers in superclass 5. They advance through innovation, changing, evolving, discovering, and inventing. Then there's a lot of this thinking, analysis, planning, problem solving, solution finding, that kind of exhilaration that they need for their brain. So they're very competitive. They want to kind of stand out, getting the praise from their other from the surroundings. So argentum nitricum, carcinosin, sepia, it all belongs to superclass 5. Hmm? So a lot of people who are, whose perception or who wants to be more creative, more artistic, refining their skills. So musicians, scientists, high level professionals, they all we can think about superclass 5 themes for them. Hmm? If you see a horse, he cannot be in one place, right? There's constantly movement. You want to come out. They want to think outside the box. So they are achievers, performers, risk takers. Okay. Then lot of fear of being in the narrow places will be there. So claustrophobia, because they feel very trapped inside and they want to come out of it. And also feeling of constraint will be there. And more masculine themes will be there. So thinking about themselves, more achievers, go-getters, those kind of people will think of ourselves. Hmm? What this is about, what Dr. Shankar sir has talked about from the sensation and superclass point of view. If you understand from PM perspective, where Dr. Mahesh Gandhi has said about carcinosin is the inner age. The PM method is depend on the classifying the inner age of that individual. Okay, and it is the basic of it. If you all are new for sensation and PEM method, then we have other courses like the basic course and classroom to clinic courses where we teach these contemporary methods at a very detailed and a basic level so that you can practice them. And it has really helped in our journey to prescribe and come to a remedy. Okay, so according to Dr. Gandhi, he said it is the age is of mature adult. So around 40 to 50 years. So imagine the how the mature adult are. So your biological age is say can be anything, but inner age belongs to this mature adult. So they are very responsible. Okay. And they feel that if they don't become responsible, there can be collapse of the world that they have created for themselves. So they want to kind of perfectly control this his own life, and he cannot rely on the others. So in the carcinosin, there's a lot of this feeling of forsaken, feeling of being alone, and they feel that they want to do things on themselves so that they cannot rely on the others. Hmm? And it has both the themes, when you see psychotic, the differentiation in the theme of psychotic miasm and the cancer miasm. Psychotic miasm is also they want the need from the people to get the acceptance. Okay. But psychotic people, they do it with by covering it up. And cancer miasm patients, they become more of responsible and get that acceptance from the people. Hmm? So their main kind of lesson is to learn the self-expression and bring their own creativity and fertility. They bring their own potential outside. That is their lesson to learn in this life. Hmm? Then Dr. Sarkar has given a lot of clinical indication in his books, and it gives you a lot of differentiation. Like, if you say look like so the mind of a child or a patient look like arsenic album. Okay, but he's like very fastidious and anxious disposition, but it has more of a perfection into it and other things, then you can think of carcinosin. Okay, children who will need this remedy will be very precautious. It can be a mixture of ignatia and lycopodium. So lycopodium, uh, the part of it is of the anticipation, the anxiety, and the ignatia being very controlled and responsible and suppression of the lot of emotions within. So you see this mixture, you can think of carcinosin as a remedy. Also, there is, if there is any repeated history, either there was a lot of acute infection that they had, or no history of any acute infection, can also, we can think of carcinosin. They like thunderstorm. They like to be in the rain, dancing in the rain. Then recurrent abscesses, fistula, sinus infections, and keloids. If we see this, then also we can think of carcinosin as a remedy. Then Van der Zee also said that physical pathology is what happens in cancer. That there is first, there is a growth, right? So there is a lot of the psychotic processes are happening, the growth, and then which can later end in the syphilitic way, in destruction way, right? So we see that in the patients also. Okay, so initially there will be a lot of suppression, and constantly there is a lot of accumulation and lot of suppression that we see at the mental level also, right? So it is a very good remedy for children who are rejected, okay, or they feel very sensitive in form of rudeness from the others, right? They're very impressionable. So strong sense of responsibility that comes up, okay? Then too much, too early responsibility that they take it, but which can lead to the destruction, which can lead to the despair of the syphilis, because these efforts are too much and which can end it in destruction. So they can have anger for their own mistakes, or they can become very fastidious. There will be a lot of anticipation about relatives, about the environment, and a lot of hurry to reach to any place, or if there is time is set. So it will look like lycopodium, it will look like ignatia, it will look like phosphorus, right? It will look like sepia, it will look like tuberculinum. But all of this together is carcinosin. Hmm? And if you know, we know the very good part of carcinosin, right? We know that they are very obedient, very sincere, very, very, well-mannered, well-behaved children. But if you see, there is another side of a carcinosin, which is lesser. So, and if you see, the rubrics show that the other side is of the destructive side, or this opposite side of too much of control that was there, and there can be out of control behavior. So there can be a lot of anger which is violent, they want to throw things. There can be a lot of temper tantrums which we can see in the children, lot of cruelty, brutality, inhumane behavior. We can see carcinosin, they want to fight, they become rebellious, biting, destructiveness, disobedience, want to tear things, shrieking, screaming, quarrelsomeness. So these two sides are also seen in carcinosin, right? We know as our perception about the good side of it, but there is the another side which is a destructive side, more towards syphilis side of the carcinosin. Okay. If you see rebellious, and there are a lot of these rubrics that match for carcinosin. So they are very, very rebellious. Okay. So authority, refusal to accept, change, desire for, they want to fight. They're very censorious and critical, disobedience, obstinate, moral affections want, okay, they reproaches others, and mind rudeness. If you see carcinosin come in all the rubrics, comes very close to nux vomica, you see, which is also coming very close to mercurius, which is the remedy from lot of destruction, right? Destructive behavior. Also come near, if you see the fourth remedy, come very close to lachesis, come very close to lycopodium. If you see, comes a lot of similarity between tuberculinum as a remedy, right? But when we see only this process of control, lot of superhuman effort, lot of anticipation, perfection, fastidiousness, which can lead to death and destructive. For them, their survival is to kind of have these efforts. Otherwise, there will be death and destruction. Their failure can become destruction or a death. Their perception is like that. Hmm? So let's come to the comparison of remedies. So if you see, tuberculinum comes very, very close to carcinosin. So what is tuberculinum? Tuberculinum is also from, from the fifth superclass as a remedy. The main feeling is that they are caught into something and they want to just break free. So when you see only this part, then it becomes tuberculinum as a remedy. Okay. They also have travel desire too. They also want change desire, uh, like carcinosin. They also are very, very destructive, as a remedy as a tuberculinum. Okay. But if you see in tuberculinum, the more focus will be of rebellious. More focus will be to come out of it, to get away from that situation. But in carcinosin, the main focus will be to control. How I can control this whole situation, how I can put tremendous effort to control what is happening around me, to bring the order, to bring it in the order, this chaos which is happening in my life. And if I don't do it, then there will be death and destruction. So they kind of put a lot of efforts into it. That way it will be differentiated from the tuberculinum. If you see common rubrics of tuberculinum, you see escape desire to, activity desire to, they are also very adventurous, lot of anger, authority refused to. So it comes very, very close to tuberculinum as a remedy. Hmm? But this is how we differentiate. Then if you have to differentiate cancer miasm remedies like, arsenic and argentum nitricum. So arsenic main theme, what it will be, they will have more issues of mineral kingdom, right? So there will be a lot of talking about their structure, their kind of a lack within, and how they want to kind of get money. What is it is belongs to the fourth superclass, fourth row. Themes will be there about anxiety, about health, money, and kind of gathering the entire money so that they can have the stability and security which they are losing because arsenic is on the right side of the periodic table. Hmm? But if you see the art, the music, dancing will be completely different in arsenic. It will not be there. But if you see in carcinosin, it will be there. They will also have a lot of anxiety about health, about diseases and all. But their main focus is about that control, about that superhuman effort. And the other thing that can differentiate is their artistic way, right? Then if you see in argentum nitricum, they also are from the mineral kingdom, but they belong to the fifth row of periodic table. So they will have a lot of these um, issues of doing new thing, learning new thing, refining, getting better and better in their own skills, which also look like carcinosin. But in argentum nitricum, there will be theme of performance will be there, where there is theme of mineral kingdoms will be more prominent, and then we can differentiate from the carcinosin. Yeah. So I hope with this whole understanding, let's see few cases. They are the short excerpts of the cases where you can feel the essence of the carcinosin in these remedies. Hmm? Let's go ahead. So this is a case of a 65-year female. Okay. And she came to us with the diagnosis of plantar fasciitis. And there was a lot of this left heel pain. It was aggravated by standing, walking, and all the common, modalities of plantar fasciitis was there. When we took the case, she was very well dressed, very soft spoken, and very well mannered lady. Okay, and very soft when I spoke to her. She gave the history that the mother died of CA in when she was very young. So when she was 21 years old, her mother died, and she still, when we spoke about it, she was still very, very sensitive about it. So we have the history of cancer in the family, which was very strong. Okay. Then what happened was after the death of the mother, she said, when the mother was dying, she holded my hand. The mother holded my hand and said, that I'm worried. I'm very worried for my, all of you, like all of the children. And because the mother died when she was around 46 or 47-year old, so very early age of her life. So that was a very sensitive moment for her, and she said that I am the one. She was not the eldest one. She was something around, I think they were all four siblings were there, and she was, I think, third number or fourth number. And she decided that I will take the responsibility of all the, my brothers and sister. And she actually took the responsibility, and she was very motherly to them, very sympathetic, very compassionate, and she did everything for them. When the mother was diagnosed with cancer, and when she died, her marriage was there, but she said, no, I will postpone my marriage. I will do, there was certain thing which needs to be done for my, my sisters and brother. I'll do that, and then I'll get married. And she did that. After the marriage also, the in-laws place also become, very important for her as a responsibility, right? So she took up a lot of and continued for so many years till now, 65 years now. So much efforts and so much of, responsible individual. At the level, the daughter says, mom, you're doing so much for everybody, and for me also you did so many things, but there is a lot of things that is pending in my life. The daughter was worried for that, and she said, no, I will be able to do it. I have that capacity. So you see that kind of a stretching, that kind of a responsibility that we see in Carcinosin. The love, she loves going out, no, but at the same time, she cannot take domination. She is very strong-headed that she wants to do things, but at the level of very compassionate and sympathetic. She loves bhajan and singing and dancing, and so much. She said that I have to, if I go for some, or I'm say singing, then I have to put an alarm that, now the things are like the time is over. Otherwise, I'll keep singing only. I'll be so much into it. He loves going out. Fear of heights and health was too much prominent in him. Very perfectionist. Everything that she does has to be very perfect, very fastidious, and lot of OCD for cleanliness. She'll keep doing things again and again and again. Hmm? And she did really, really very well with carcinosin 1M. She didn't need any other remedy than carcinosin. Perfect picture of what we know as a um, carcinosin as a remedy. And almost we continued her treatment for 1 year, and she was perfectly well. She didn't kind of, did any other allopathic medicines also for that matter. Another case, which is a very, very nice, and it's still ongoing, but she had a very good result with this remedy. So 7-year-old female child, she is known case of autism, and she was diagnosed when she was 2.5 years old. And the complaint had started after the COVID. Okay. So what has happened? The screen time has increased, and she was at home all the time, right? So since then, the complaint had started. When inquiring, we came to know that the child before, and she actually showed a lot of videos and her, going to outside and all of those videos, which shows that she was very cheerful, playful, and very mixing kind of a child. He was communicating very well, talkative, and we were unable to believe that this is the today's situation and what she was completely different. Hmm? And now she diagnosed with ASD. And now the current picture, what we see here is the chief complaint is the social anxiety. She doesn't want to go out. She has a lot of anxiety when somebody new people come. Okay, it gets aggravated when her routine changes. When initially she wanted to do new things and kind of go out every day like that. Now she doesn't want to try new thing, and initially she used to go for dance every almost every day, 5 days in a week she used to go for dancing. Loved that way. And now it's completely opposite of the picture that we are seeing. So the history was, when we kind of elicited the history of it, was the parents are very learned professional. I think the mother is a lawyer, and the father is also at a very high position, so very learned professional, and they had a lot of high expectation from the child, so she used to say, you need to do this, you need to do this very perfectly, let's complete this task and then only you can play. This is how you have to behave socially. So there was a lot of these pressure when we elicited the history. This lot of pressure they try to, and long standing it was there, and that pressure continued, and that pressure is still there because the mother feels that even if she's on the ASD, I don't want to put her into special school, right? So the whole outcome of this situation has become that now the child is getting very very anxious. There's too much of burden, too much of expectation. The child has become very anxious. She doesn't do things perfectly, then the anxiety will seep in. Okay, then if there is something that is expected and if it doesn't happen, she will start getting lot of panics or anxiety. Hmm? So what is happening that too much of expectation, too much of dominance has made that child very very conscientious and anxious, and now she started expecting herself to be very very perfect and do things very well like the mother wanted. Hmm? And so she's a very mild child when we saw in her in clinic, and she did amazing, beautiful drawing and painting and coloring that she did it in the clinic. Very sensitive, like how we see in the plant-like sensitivity. Very loving, very obedient kind of a child. And the mother says she loves to, stay with the father more, who is less strict than the mother. So you see the whole picture which is kind of emerging from this kind of a causation or a modality. And she did perfectly well. She is still on the treatment, but she did very well in terms of her treatments are concern of anxiety and this panics that she feels. Very, very good example of carcinosin. Another example, 17-year-old, male child, and this whole situation and the aggravation started when he was preparing for the NEET examination. Okay, so there was constantly he was feeling that everything will go wrong, and what has happened, he was like a very very good student academically, right? But in the examination or those the class test or that weekly test that he used to have, they were very very tough for him, and those were kind of he was unable to, he used to put a lot of effort and do things, but it was not giving him his own expected result, and that kind of broke his confidence, and is almost zero when currently when we saw him. Then there was a lot of this anxiety. For initially there was a lot of anxiety, and then it is to lead to a very negative thought, depressing thought, that I will not be able to do this, I will not be able to do that, I want to go somewhere and live where people are not asking me about all these things. And then he started having suicidal thought that I want to leave everything and go away, I want that escape, where nobody will ask me, some island or some forest where nobody knows me, I'm not answerable to anyone. So this is a kind of another side of carcinosin, which is with this superhuman effort reaching to the destruction and a death. That is what we are seeing. So there is this self-imposed perfection. So here the parents are, I think, very cool, they are okay about it, but these expectations that he has put himself under, and he wants to do the extremely well, performing well, or in his doing things, or kind of performing very well in his exams. So a lot of compulsive thought for perfection that he has. And his nature wise, if we see, too much responsible, he wants to have control over thing. Perfection performance is very very important, very sensitive to reprimands and criticism. He's almost suicidal, and he's very sympathetic and very compassionate and very artistic. Loves music, loves learning classical music, dancing, and drawing. And a lot of cravings that we see in carcinosin, ice cream, milk, chocolate. He also had that. And he did really, really very well in carcinosin as a remedy. He did it perform very well because what did we see? And as a child, when the mother said his child in the childhood was very angry. He used to throw tantrums. He used to be very, very disobedient kind of a child. He always wanted to go out. He never stayed in one place. Very restless. And in today, when we see, he's very obedient, very, very conscientious, and very, very well mannered and behaved child that we see. So he also did very well in with carcinosin. So we see a lot of different themes in these cases. So in case one, what we saw is more of a responsibility. So we saw the one side of carcinosin, which is very commonly we see the obedient, sincere type will taking the responsibility. Case two, we saw the actual kind of a causation of strict parenthood, and still they want to behave themselves in a way that the parents want to behave, and they put lot of efforts. We saw in the second case that child is she's becoming conscious about her performance if she is not able to do things right. And in case three, we see the other side of it, the destructive, or that the more towards syphilitic side of it, of suicidal tendencies, right? And these high expectations from his own self, and the destructive side that we see. So all these different kind of shades of carcinosin we can see, and we'll be able to elicit in our cases. Yeah. So this is what I had for carcinosin. If you we are doing these remedies every month, new remedies, and if you and for carcinosin specifically, we are going to give some handouts which are kind of a desktop for those remedies. And for that, you have to register on our website. I think the skin has already sent the link. Do register and get those handouts. It will be really, really, really very, very helpful for all of you in your practice.
Ma'am, if you wish, I can just share one of the example of those handout. So you can.
Yes, you can do that. It will look something like that, which will give you the entire holistic aspect of the remedy.
Give me 1 second, I'll just share. Yes, so we are on the season 2, and already 4 remedies have been covered. One of them is Ignatia, and the handouts will look something like this, where you will get to in one go you will get
Yeah. So
access
you
to
will
all
see
these things.
the one side of the classical method, what are the details of that remedy from in form of their natural history, what were their medicinal uses, what were the keynotes, and then the contemporary side of it, where what Dr. Shankaran sir has said, Dr. Gandhi has said, what is in terms of superclass that we see, and then our tips, like our clinical tips, what we have seen about these remedies in the practice, which can be very handy when you're seeing patients. So this would be an kind of a desktop guide for all of you to refer. And I think this will be a complete whole study of it.
Yes, if you have any questions regarding the registration, do reach out to us. We are happy to help you. We'll guide you along if there's any questions or queries. I'll leave the number below. You all can contact on the numbers, and we'll be happy to help you out.
Yeah. And if you have any questions, any thoughts, anything about carcinosin that if you want to share.
Ma'am, there's one question. Ma'am, please tell CT questions for carcinogen. What I did not understand.
Um, If Vaishali, if you can tell us, CT is confirmatory. Is that what I'm understanding right?
There are a few more questions, ma'am.
Yeah. So, if carcinosin as a, if I understand it, confirmatory questions as all of it together can confirm, and if you see it together, then carcinosin is indicated. But also, if you see the nosode indication is very important. To come to a remedy carcinosin. So that nosode presentation, that process of infection, as I said, should be there. Okay. Then other themes which we saw about, you know, about the fear, the anticipatory anxiety, the causalities, family history of cancer, seizure ameliorates or aggravated, lot of cravings that they had, then the fear of diseases, health, exams, all of that could be a confirmatory for carcinosin. So when you see, you look at the holistic aspect of a individual and not just one side of it. Okay. Is the artistic abilities are must in the case? I have seen some cases where the entire premise fits well, but no artistic ability. I, in my practice, I have always seen they've been very, very artistic, and they have longing for artistic aptitude like music, singing, dancing, or coloring, painting. Yes, we have a recorded session. It will be there, available on our website if you can log in and see it. Carcinosis and cocculus. Okay, cocculus is the plant remedy. Okay, and it is from the first subclass, okay, of the plant chart, the dicotyledon. In cocculus, the main theme, because it belongs to the Menispermae family, but ranunculates as an order, the main theme, there will be a lot of the sensitivity, reactivity will be seen, plus there will be psychosomatic complaints will be seen, which is very, very important in ranunculates order. Okay. And there were, of course, the other themes of cocculus. You'll be able to see it as per the materia medica, apart from carcinosis. Yes, perfection theme can be self-imposed. We saw that in the third case, right? It is self-imposed also. How carcinosin is used by many doctors for autism? Because if the themes match, then we can use this remedy, no? Any remedy, but any autism case in that matter, what we have to find, what is the individuality of that child? What do we see, right? It is very important to have history of cancer, and which is most of the time is there. But of course, the whole picture should also match. Potency to be used depending on the patient's level of expression, right? So for the autism patient, we are using 200. The third case, I've used 1 m up to 10 m also I've used. And the first case, 200. Carcinosin after follow well are ignatia, sepia, lachesis. They are also good remedies, but you can find it out in boric and fata, the remedies that follow well. Yeah, if it is there, the theme of abuse, then you can. There are cases where I've seen case of abuse a lot in carcinosin prescription. It's not necessary that you will see it in everything, but it is one of the very important causalities. Can it be used in carcinoma advanced stages in patient? If the holistic totality matches. then yes. I'm very happy to have these questions answered because yeah, I like your enthusiasm and desire to learn. So I think that's good. Thermal reaction, they are either, they're extremely sensitive for heat also and cold also. Repetition of the dose, it's a big topic of a follow-up. So how the patient reacts during the follow-up depends on that. And I think for that there are a lot of, you need to learn that, right? So there are different variations that can come up. So in our classroom to clinic course or basic course, we teach that. We show it the long follow-up cases, then what we have to do in those. So I think you should take part of in those courses that you learn it more. Low dose in CA advanced stages, mostly because the pathology is something which is expressing more, right? So most of the time it is used, but of course it depends on the level of expression, as I said. What is the level of the patient where it is expressing? If it is expressing at the level of, say, emotions, then the 200 potency. If delusion experience, then the 1 mg potency can be. Is it safe to use it in LM potency? Yes. Very well. In fact, it is very helpful, the LM potency, because the aggravation is very less. And if there are chronic pathologies, then LM can be indicated. Okay, anything else? Last thoughts? Okay, Taski, over to you.
Thank you, ma'am, for such a wonderful session. We have a lot of these sessions every month. So y'all can register on the website. As I said earlier as well, you can get not just Carcinosin handout, but also for the other four remedies we covered in season 2. And you can also get access to the recordings as well. In case you're having any difficulties in logging in, I have already shared the number. Please do contact and we'll be happy to help you. We have also many courses on our website. You can visit our website and you can register directly for any of the courses you wish to on our website. Thank you all for joining for today's session and see you all soon.
Bye bye.
Bye.
Thank